Okay, today our viewer question is, can a whole food plant-based diet help with vertigo? Are there any foods to avoid that might make it worse?
Oh my. Vertigo is a medical condition characterized by a sensation of circular movement. The room is spinning around. That's vertigo. Uh, we physicians aren't crazy about the term dizziness. People say, "Oh, I'm dizzy." Well, is she saying that she's got true vertigo where the room is spinning around, or she just gets up suddenly and she's lightheaded? Those are two different things that people all just say dizzy. But the lightheadedness is another issue altogether. If you've got true vertigo, that room is spinning around there. You have trouble walking in a straight line, feel like you're going to throw up, you want to sit down. That's vertigo. It's a complex subject. There's roughly two types of vertigo. So-called peripheral vertigo, the most common type, comes from a disorder in your middle ear. We have our balance mechanism there, and one of the little crystals that helps us orient in space has broken loose inside our balance mechanism there, and you need to reposition that. And there is a maneuver one does. You sit in a chair, you bend forward, put your head down between your knees, and I will, accompanying this video, Annie will post the link to the YouTube clip. It's 10 minutes long. So you can learn how to do this maneuver at home and correct your own. This is called benign paroxysmal positional vertigo, BPPV. And it's the most common type, and you should know how to do this maneuver so you can reposition that little crystal, the otolith, back where it belongs. The other sources of peripheral vertigo, there Meniere's disease, where the balance mechanism accumulates fluid, acoustic neuromas, things that affect the nerves there, as well as the central vertigos when people have tumors and strokes and things like that. If this is a new event for you, go see your doctor. Let her or him make the diagnosis. If necessary, send you to an ear specialist or a neurologist. Make the diagnosis. Make sure it's not something ominous. But if they say no, it's just benign vertigo or Meniere's condition, then, as I said, we'll give you the link to show you how to deal at least with the BPPV. Now, that said, she's asking, are there foods that make this worse? If you have Meniere's disease, where there's swelling of the balance mechanism, it turns out that a high salt diet is not your friend. It makes you accumulate more fluid and increases the swelling there. So in general, you want to be on a low sodium diet. There are other conditions where lots of sugar is not your friend either. So like everything else, we're eating a whole food plant-based diet. Make sure that you're not eating a bunch of processed foods loaded with salt. Stay out of the restaurants, the commercial spaghetti sauces and all these high salt foods. You don't want to be eating them. As well as you don't want to be drinking cola drinks and flooding your balance mechanism with lots of sugar. Is there anything else? There's medications can do this. There are medications for blood pressure, medications for depression, medications for seizures. There's some antibiotics can cause vertigo. There's anti-inflammatories can cause vertigo. So especially if you've newly started a type of medication and now you got vertigo, pick up the phone or email your doctor. Tell them, I've got vertigo here. Could this be from my medication? And make sure that that's not a problem either. But by and large, keep your diet really clean, lay off the salt and the sugar, and learn how to deal with the benign paroxysmal positional vertigo. And hopefully this very disturbing symptom will not be a frequent intruder into your daily life there.
Oh, well, thank you so much for that. As someone who unfortunately has had vertigo before, it is extremely unpleasant. So as you mentioned, I will definitely link to that video, and hopefully all the other information about the food and the medicine, is helpful to our viewers out there that could be suffering with that. So thank you so much, Dr. Klaper, for your wisdom on that. And thank you everyone for tuning in. We will see everybody next time.
Take care. All the best. Hi, everyone. Dr. Michael Klaper here, announcing our new format for our Q&A with Dr. K. Annie Hagen will be asking me one question that's been sent in by our viewers. So if you want to see if your question is getting answered, do join us for our Q&A with Dr. K right here. Hope to see you then.